Thank you to the Moving the Needle corporate sponsors, Home Infusion Options and Metro Infusion Center, and our exhibitors, Takeda, Janssen, and Bristol Myers Squibb. You share our mission of advancing patient care and make events like this and our grant making possible.
So now it's my pleasure to introduce our next speaker. Dr. Noa Krugliak Cleveland is an instructor in the Department of Medicine. She's also the newly named director of our intestinal ultrasound program. And if you're wondering what intestinal ultrasound is, you're about to learn her. She is not only the director of our program, but there's only 2 programs in the country offering this currently in the way that she's built our program. And you're going to hear not just what this offers patients who have inflammatory conditions, but also the research that GIRF is funding that is part of this. Like Dr. Dalal, Dr. Krugliak Cleveland trained with us and then moved on into faculty and has had support from GIRF along the way. So another example of how important that support has been. Noa?
All right, thank you. So before I go into the grant that I received funding from GIRF to complete, I just want to give you some background since intestinal ultrasound is very relevant to what I'm doing with this grant funding. So you can see here an image of an intestinal ultrasound exam, where this is in a video. It's called a Cine loop of a small intestine, a patient with Crohn's who has quite a bit of inflammation. The blue and red shouldn't be there. It's a sign of increasing blood flow and inflammation. So you could see how clear and beautiful and how easy it is for a patient to visualize with me while I do this exam. So intestinal ultrasound is a real cutting edge tool for inflammatory bowel disease. And we're one of 2 centers in the whole country that offers this right now as an integrated tool in IBD care. Intestinal ultrasound is similar to the abdominal ultrasound that a pregnant woman receives. We just put gel on the abdomen and scan the abdominal wall. We can visualize the bowel, the small intestine, and the colon, and we could use it to measure inflammation, both Crohn's and ulcerative colitis, and even in patients who've had surgery to assess whether Crohn's has come back or whether if patients who have a pouch, which you just heard about, whether they have inflammation in the pouch. So it's an incredibly valuable tool. It's unique. We have no other tool like this where we can assess for disease activity in the clinic visit without delay. It's not invasive. It doesn't hurt. You don't have to prep for this at all. And you could do it as many times as you want because there's no radiation involved. It's also covered by insurances. You don't need any prior authorization. So you can really do this and get a lot of information. And I'll tell you that once you start performing this, you'll realize how much other providers who don't have this tool kind of work blindly and how much delay there is in care while you're waiting for results of other therapies. So the grant I received, the grant support I received was to look at the effect of ulcerative colitis on patients' rectal function and how that affects symptoms. The background of this is patients with ulcerative colitis tend to have symptoms, and we see that at high prevalence, over 50% of patients will continue to have symptoms even in the absence of inflammation. And all of you who are familiar with treatment of ulcerative colitis or inflammatory bowel disease in general, we aim to quiet down inflammation, get patients into mucosal healing or healing all that inflammation. So why are patients still symptomatic? The real goal is for patients to have 100% normal quality of life. And if we're not achieving that, we're missing something. And this is what I am to look for. So we previously shown, we're the first to show that patients with ulcerative colitis lose the rectal function or the elasticity of the rectum. And there's other data that show that patients with ulcerative colitis have scar tissue that forms in the rectum. And so my study is looking to connect these dots of how does the structure of the rectum and the function of the rectum connect or lead to changes in symptoms or persistence of symptoms, even in the absence of inflammation. What I hypothesize is that inflammation over time leads to scarring and rectal dysfunction, and you'll be able to see it on ultrasound, perhaps other modalities, but I don't think MRI will be as sensitive, and definitely on colectomy specimens. So we'll be looking at structural changes on ultrasound, MRI, and those who've had surgery, connect and see if we can predict what we see on those surgical specimens in a non-invasive tool like ultrasound, what you could do in clinic. So far, we've worked on the infrastructure. So again, we're one of 2 centers in whole country. So building a program was quite a big undertaking, but we have now announced our program in August of 2022. We actually have 4 providers who are scanning patients. We have a dedicated ultrasound clinic. We have 3 machines. We're offered this to inpatients, patients who are admitted, and we've received also multiple grants, one from the AGA and one from Humsley, primarily to disseminate educational intestinal ultrasound around. I've also submitted a large grant to the NIH to support a 5-year plan to study intestinal ultrasound in ulcerative colitis for the same purpose.